Well, hello, everybody. My name is Melissa Mazor, and I am a nurse scientist in the Community Outreach and Engagement Program at the Tisch Cancer Institute. And I am so delighted to be with all of you today. So to start, if we can go around and please introduce yourself and provide just a very brief background about yourself and your role in cancer care.
Hello, everyone. My name is Christian Rolfo. I'm a professor in medicine at the Sinai Icahn School of Medicine at Mount Sinai, and I'm the Associate Director for Clinical Research at the Center of Thoracic Oncology. My focus of interest is cancer care for thoracic oncology patients, and also specifically, I'm working in drug development and biomarkers in liquid biopsy.
Hi, I'm Dolores Moorehead, and I work for the Women's Cancer Resource Center, where I am a Community Engagement Director and Client Support Clinician. And what that includes is I provide patient navigation to our clients that we serve. I also provide therapy to them and lead support groups and work with different researchers around the needs of diverse populations.
Hello, everybody. I'm Lavern McDonald, and I'm a community scientist with the Icahn School Mount Sinai Project. I'm also a social studies teacher at a small independent school in Manhattan, and I was diagnosed with lung cancer in 2018.
The part about being educated, you are taking care of this family member and you're wanting to do the best that you can do. You are receiving a lot of information. You're writing it down. You're in the doctor's office or the clinic with them. And then you want to do the best, and yet you could feel overwhelmed. And how do you get support to help you make informed decisions, to help you learn about clinical trials and how that makes a difference? And I think the caregiver often gets kind of overlooked, and yet they have this important role to make the best decision, to know when to call, to trust that if they've pushed their loved one to go into a clinical trial and things aren't quite going okay, who do they call on and who do they talk to, and how do they feel like the doctor is the doctor going to hear me? Because the doctor's not treating me, the doctor's treating my family member. But to be able to know that they're supported. Do I call the social worker? Do I call the nurse? And I think it's important for us to include that caregiver and also to give that caregiver a chance to have a voice that's separate from the patient. I will just say from my experience, I've seen individuals that receive services in our organization who are financially more, they're well off, they're educated, and they're going to push through. They're going to ask those questions. They're going to go for it. And then I'm seeing those who have received and been the brunt of racism and oppression that don't just come forth and ask. So it's important, I feel, for individuals to notice that. So for me, I'm looking at how do I provide resources? When someone says something to me like, I can't, me and my family can't afford a clinical trial, then I take a community resources and I say, here's this is what I know about it. And in fact, we could call together. Or you can call and tell them, I told you. I think we have to make sure that folks know about resources, not that the burden now falls on the caregiver all by themselves, but that we're there, whether it's the social worker, the nurse, to give them the resources that will help them. Because they themselves are dealing with racism, and they're dealing with feeling barriers to care, and then they're feeling the barriers of care that their family members may be experiencing, and they don't feel empowered. So how do we create that opportunity for empowerment?